Hi, welcome to Stay Healthy Facebook Live program of Bumrungrad International Hospital. Today we have our colorectal surgeon, Dr. Navara Dusitanond, and he will talk on colorectal cancer. Are we at risk? And I'm Dr. Sanimin, Senior Coordination Physician, will be co-hosting this Facebook Live today. Before starting this Facebook Live session, please allow me to introduce Dr. Navara first. Dr. Navara graduated his honor MD from the Faculty of Medicine, Chulalongkorn University, Thailand in 1999, and he completed his Diploma of Thai Subboard of Colorectal Surgery in 2007. His special clinical interests are in laparoscopic colorectal surgery and anal fistula surgery. During Facebook Live session, you all are welcome to ask questions at the comment box, and we will try to answer your question at the end of our discussion. So, สวัสดีครับอาจารย์ Navara.
สวัสดีครับ สวัสดีครับ
So today on the Facebook Live, in our Facebook Live session, the topic is colorectal cancer. So how common is colorectal cancer, and why do we need to give attention to it, ครับอาจารย์
Actually, for the colorectal cancer, it is the one of the most common cancer. If we see from the record or statistic, is the third ranking of the cancer that occur in the human, and is the third common cause of death from the cancer in the population. And the incidence of the colorectal cancer is increasing if we get older. If the patient is above 50 or older than that, the incidence of the colorectal cancer will be increased.
So is there any difference in the ethnicity, ครับอาจารย์ so compared to Asian, African, or European, like which ethnics have
the ethnic most common of the colorectal cancer occur in African American or in Western country. Actually, in Asian people is lower when compared to Western person, but recent decade we found that it's increasing, maybe related to environment, the kind of food or lifestyle.
So you mentioned about like colorectal cancer can be related to the environment and the food and the lifestyle. So what kind of environment factor can lead to colorectal cancer, ครับอาจารย์
Actually, the exact cause from the environmental factor or food cannot be proved properly, but we think that it may be the risk of the colorectal cancer. Like if we eat processed food, red meat, high in red meat, low in fiber diet. That is the food that can increase the rate of the colorectal cancer. And some lifestyle, like if we getting fat, not have physical activities or smoking, use the alcohol, this type of person have increased the risk of the colorectal cancer. So for this information, we think that the lifestyle, like the in the more westernized, can make the colorectal cancer become increasing.
So how about the incident in the Asia, ครับอาจารย์ so especially in Thailand?
In Thailand, actually the incidence is increasing. Around 10 years ago, the rate of the colorectal cancer in Thailand is around 5 per 100,000. But now it's increasing around 10 to 20 in each institute, around 10 to 20 per 100,000 per year.
So like the risk factor can be environment or food and also lifestyle. So is there any exact cause to have colorectal cancer, ครับอาจารย์
Actually, for the cause that we can prove is the gene mutation. So for the gene mutation, we have two groups. The first group is they get the gene mutation from their family. Like if there is some gene mutation in that family, most of the people or family member have the risk of the colorectal cancer like FAP, we call familial adenomatous polyposis. That is the group that prove that they have the increased risk of the colorectal cancer. Another group is the acquired gene mutation. This group means that person, when they born, everything was normal, but when they grow up, there is some change of the gene, and finally it turned to be cancer. So that is the thing that we can prove, that gene mutation is the cause of the colorectal cancer. But other thing like food or environment is just risk, is not the cause.
When we mentioned about colon, so colon is a long tract. So like our audience may wonder like which part of colon can have like more common, which part of the colon is like common to have cancer, Kapitan?
Actually, the colon and rectum is the long tube, around 2 to 3 foot long. So most of the colorectal cancer or polyps, it will be start at the sigmoid colon and rectum. More than half of the case occur at that area. Sigmoid colon is the part around 30 cm to 40 cm from the anus, and the rectum is the part that just above the anus, if we count from the outside.
So, what kind of symptom will the patient present for the colorectal cancer, Kapitan?
Actually, there is no specific symptoms for the colorectal cancer, but most of the patient who has the symptom may have a bleeding per rectum, mucus bloody stool, lose their weight without any try, something like that, weight loss by themselves. Change in stool caliber, like it looks smaller when compared to last month, or change in their bowel habit, alternate from diarrhea and constipation. And some patient may feel some mass, but if they feel some mass, it means that okay, it's big enough to diagnose by themselves.
If a patient like present with these symptoms, and then like how can we diagnose or how can we screen like whether they have the risk of having cancer?
If they have symptoms, okay, we will follow that which symptom that lead them to come to see the doctor, and the investigation or examination depend on the symptoms. But if they don't have any symptoms and want to get some screening, the best screening method for in the present day is the colonoscopy. Colonoscopy is the gold standard, and it's the best method to screen the colon cancer. But if some patient doesn't want to get the colonoscopy, or they don't fit enough to get that kind of procedure, alternative way is a stool exam with the fecal occult blood test to check that is there any blood inside the stool or not. Or another alternative is the CT colonography. We use the CT scan and use the computer program to generate the picture like we do the colonoscopy, but by computer, not by endoscopy technique.
So if there is any abnormal finding in the fecal occult blood test or in the CT scan, like finally the patient will need to have colonoscope.
Correct. We still, if we find something abnormal, we have to confirm with the colonoscopy.
So colonoscope is the gold standard to detect the colorectal cancer.
Yes.
So how about in the normal population, like a patient who doesn't have any symptoms yet, and like they would like to come and check up if there is any risk of colorectal cancer? So would you recommend colonoscope for the routine checkup?
Yes, for the routine checkup, if anyone who age above 45, I think is best timing to get the colonoscopy. It's not necessary to get it yearly. If the result is normal, the next colonoscopy will be 5 to 10 years. but we start from age 45 from a current guideline. But if the patient have the family member who has the colon cancer, sometimes the age will be lower than 45, maybe start from 40 or lower than that. It depends on the type of the cancer in their family.
So in case like in the colonoscope finding there is a polyp or the polyps in the finding, so is there any how often he has to follow up for the colonoscopy and how many % chance of converting to the malignancy?
Okay, good question. It depends on the type of the polyps. Most of the polyps that we found is hyperplastic polyps. It's benign and pure benign. It means that it cannot change to be the malignant one. But another thing that we found is the adenoma group, adenomatous polyps. The chance to turn to be the cancer is around 4 to 40%, depend on the detail of the adenomatous polyps, from the tubular adenoma to villus adenoma. So the best way is if we find the polyps in the adenoma type and we can remove it by the colonoscopy, it can prevent that polyps to turn to be the cancer. And it's the best way to prevent the colorectal cancer by remove that polyps out. But finally, if we find the cancer, sometimes we cannot do anything with the endoscopy anymore. We have to do something else to treat the cancer.
So, what kind of investigation and the treatment available in our Bumrungrad International Hospital for the colorectal cancer?
If we find that the patient has the colorectal cancer, we have to do the pre-treatment staging first by CT scan, or some patient need PET CT to check that is there any distant metastasis or not. And if we find that, okay, what is the pre-treatment staging? The treatment is depend on the staging. Some patient need chemotherapy. Some patient need the surgery. In our hospital, for the operation or the surgery, more than 90% of the case we will use the minimal invasive surgery. It means that it will not the big wound or big scar anymore. We will use like the keyhole technique. The patient will have 4 to 5 wounds over their abdomen, and we can do the surgery with the instrument or camera to put inside that hole and remove everything, similar to when we did the open technique. We call minimal invasive surgery. The first one that we usually use is the laparoscopy. And another technique is the robotic. Actually, the detail of the technique is similar, but change from doctor hand to be the robot hand.
But still, doctor is the one who performs the surgery.
Yes.
Right?
For the robot, the surgeon will still the person who operate and control the robot.
Because some people, they might think robotic surgery, and so they might think robot is the one who performs the surgery.
And for the chemo and radiation, if the patient need, we have medical oncologists and radiologic oncologists who can take care of that part. We have the many kind of radiation technique and many kind of the chemotherapy, including targeted therapy, to combine everything to have the good result.
So compared to minimally invasive surgery and the open, the conventional surgery, so what are the advantages of minimally invasive surgery?
For the minimal invasive surgery, the first one is the smaller wound, so it will be smaller scar. Inside their body, actually everything we did the same. We remove the colon that have the disease, remove all of the lymph node, allow that area. So the aggressiveness inside the body is similar. But another thing is the tissue injury to the body, it will be less. So patient will be recover faster. They can get up on the bed, hope that the next day after operation can get up on the bed and shorter hospital stay. So overall, the recovery will be faster and less wound pain, less scar.
Scar. So like it would be like more cosmetically
Yes.
effective. Yeah.
Mhm.
See. Okay. So I think when we talk about colorectal cancer, so most of the people they might think like after the surgery they have to stay with the permanent colostomy all the time. So some patient like they are concerned of permanent colostomy, which will affect to their quality of life. So is there any chance like to save the annex and without any colostomy, ครับอาจารย์
Yes. So in the past, if the patient had the rectal cancer or the cancer near the anal sphincter, most of the patient have to get the big operation and remove all the sphincter out. But because now the present day we have many techniques to reduce the size of the cancer, like the preoperative chemoradiation. The patient will get the radiation and chemotherapy before get the surgery. During that time, the mass will become smaller, and sometimes we can keep the anus, even they have the low rectal cancer. So it's not 100% that we can keep the anus, but the chance is increasing. So before do the operation on that time, we have to check the patient again that how much that it's smaller and we can keep the anus at that time or not. I think that more than 50% of the case, we can turn from the patient who have to get rid of anus, I mean remove the anus at the same time, to be sphincter preserving surgery. So the patient can keep the anus and finally they can pass the stool through their natural anus.
So like it will not affect their quality of life, yeah, with the colostomy. And so how can we prevent colorectal cancer, ครับอาจารย์
Okay, for the prevention of the colorectal cancer, something we cannot change, like a family history of the colorectal cancer or some kind of the disease that have the risk of the colorectal cancer, like Crohn's disease, inflammatory bowel disease. But something we can change, like the kind of food that you eat. If you eat more fruit, more vegetable, less in red meat or processed meat, hot dogs, quit smoke, reduce the alcohol use. This thing can reduce the risk of the colorectal cancer. But the other one is if you get the screening by colonoscopy or stool exam with fecal occult blood test, I think is the one that we can prevent the colorectal cancer too. Because if we detect polyps or the precancerous stage and we can remove it, it is the best prevention to the patient to develop the colorectal cancer. So the screening test or the screening test for the colorectal cancer, I think is the one that have the benefit to anyone who can have the chance to get it.
So like lifestyle modification is like very important to prevent colorectal cancer.
It can reduce the risk, but finally I think the screening test is
the more important. I see. Okay, so like the patient, they need to have the active lifestyle, like a regular exercise, like maintaining their weight, and also stop taking alcohol, and also quit smoking will help to prevent colorectal cancer.
Yes.
And also, as more importantly, like they need to have screen by the gold standard of colonoscope. Let's see. Okay. Okay. So, so in Thailand, like the incidence the incident rate is increasing. How about the like our neighboring country, like in the Asian region, Kabajan? So the incidence of colorectal cancer also increasing or not
increasing. I
increasing?
think in around the
Asian.
the incidence of the colorectal cancer is increasing.
Increasing.
But we hope that if in the future the screening test is available in everywhere and we can detect more polyps,
Cool.
finally the incidence of the colorectal cancer should decrease because we cut off of the polyps and prevent it to turn to be the cancer.
Cancer.
So similar to the cervical cancer in the past, it's quite common in Thailand and neighboring country. But after the policy of the pap smear for screening the cervical cancer, nowadays I think the cervical cancer is not the top 5 anymore in Thailand because we can prevent it.
See. So the incident rate is increasing because of the lifestyle changes. So like Asian people are more westernized because taking like processed food easily and also like smoking and also gaining weight, alcohol drinking. So these all can lead to have like more incident rate of colorectal cancer. Yeah. I think there are some questions from our audiences. So, one question is like, which kind of polyps is the most likely to become malignant?
Okay, the villus adenoma is the answer is the most. I think it when compared to other kind of the polyps. Villus adenoma have the chance around 40% if it keep inside the patient body to turn to be the cancer. But if after we remove that polyps, okay, it means that okay, it's already gone. But within 6 months to 1 year, the patient has to get the follow-up colonoscopy to check that is there any new adenoma or not. If it's clear, okay, we can extend the timing to repeat the colonoscopy. But if we can remove it, means that okay, we can get rid of the chance to develop the cancer.
And one patient asks, what are the classic signs in colorectal cancer, Kawaja?
Or classic sign.
Classic signs.
The classic sign, the first one is the mucus bloody stool. That is the classic sign. Another one is a change in bowel habit, like alternate from diarrhea and constipation.
So one day constipation
One
and
day diarrhea.
One day diarrhea, like alternating. So these. And after the surgery of rectal cancer, does a patient still need for chemotherapy?
It depends on the staging of the rectal cancer. If the staging is on late stage 2 or case of stage 3 or 4, they have to get the chemotherapy.
So one patient, one audience asks about the survival rate, Kabajan. So what is the overall survival rate of colorectal cancer, and also what would be the survival rate of metastatic colorectal cancer?
Okay,
Kabajan?
Good question. It depends on the staging. For the stage 1 is mean that the cancer is still inside, only in the colon, no lymph node metastasis, and it's just at the superficial of the mucosa of the colon. For the stage 1, the 5-year survival is around 80 to 90% without chemotherapy. For the stage 2, most of the case around 60 to 70% 5-year survival. Stage 2 is mean that is the cancer is invade deeper in the colon wall, but no lymph node metastasis. So the survival rate around 60 to 70%.
So these survival rate are after the treatment, after the surgery.
And for the stage 2, in some case, in the high risk group, we have to give them the chemotherapy.
Chemotherapy.
In this group, the survival rate will be increased around 5%, not much, but okay, there is some little benefit. But for stage 3, it's different. For the stage 3, it means that the patient have the colon cancer. It does not matter that how deep is it, but they have the lymph node involvement. This group, if we see only the surgery group, no chemotherapy, the survival rate for the 5 years is around 40% to 50%. But if the patient get the post-operative chemotherapy, the survival rate will be increased around 15%. So finally, it will be similar to stage 2 if they get the chemotherapy after the surgery for stage 3. And the last one is the stage 4. Stage 4 is mean that the cancer already spread to other organs. This group, actually the survival rate is not good, around 5% for the overall stage 4. But actually stage 4 or the patient who has the distant metastasis, is depend on the type, it depend on the detail of the metastasis. If it's just the single metastasis, sometimes we can treat and survival rate will be increased. But sometimes if the metastasis have the multiple sites or the lesion is very big, okay, it's around 5% that they can survive longer than 5 years.
So the earlier the stage is, like the more there will be more survival rate, right?
Yes.
So the early detection is very important in the colorectal cancer.
Yes, because for the screening colonoscopy, if we find the colon cancer in the patient who doesn't have any symptoms, most of the case will be in stage 1 or 2. Most of the case like that, I think more than 80% of the case that get the that know that they have the colorectal cancer by screening without any symptoms will be in stage 1 or 2. So the result of the treatment will be much better. And most of the patient can be treated with surgery without any chemotherapy.
So an audience asks, like he has background that both parents have colon cancer. So, and he already did the first time colonoscopy and the finding is normal. So he would like to know when he needs to redo the colonoscopy.
Okay, so the repeat of the colonoscopy should be next 3 to 5 years. If they have the family member who has the colorectal cancer, it will be faster when compared to the normal population.
So the normal population would be 5 to 10 years.
But for this group, because
like both parents have
so
the
I think this is increased. So every 3 to 5 years is the proper timing.
To have the follow-up. One question is, colon cancer can spread to liver or not, Kamaja?
Yes, it's the most common area that the colon cancer will spread.
To the liver.
So liver is the first one, and the second one is the lung.
And another question is like, what is the recommendation for undergoing colonoscopy? So which kind of people are recommended to have colonoscopy?
Okay, in the past there is some classification, but in this day, everybody who has age above 45, we recommend that they have to get the colonoscopy, and one who has the family member who has the colon cancer, maybe the age will be reduced, maybe start from 40. So there is no classification anymore that which person has to get the colonoscopy anymore. All population have to get any kind of the screening for the colorectal cancer, and the best is the colonoscopy.
So like now it's only the age is the like criteria to have the colonoscope screening.
Yes.
So without family history should be 45, and with family history should be earlier, like 40.
Yes, yes.
Yes.
And in both sex, the same.
Yes. So, so an audience asks, so the diagnosis of colorectal cancer is colonoscopy. Is that correct? And could you please elaborate the necessity to remove polyps or not during colonoscopy?
Okay. For during we did the colonoscopy, if we found the polyps that can remove at the same time, we will remove it. But sometimes we found big polyps. Okay, we have to prepare something more. We have to prepare for the operation if it's necessary. So it depends on the type or size of polyp that we found during the colonoscopy. But if it's not harmful, I mean that if it not make any complication, most of the doctor who do the colonoscopy will remove it.
So, so if it is like so every time when we see the polyps, like so it has to be removed anyway, or sometimes we can still wait and see or not.
I think it's not a good idea
Not
if we
a good
keep
idea.
it and
Keep it.
just wait and see.
See.
Because if we remove it and it is the any type of adenoma, it means that we already prevent the colorectal cancer because we already removed the polyps that have the chance to develop cancer. So I think it's not a good idea if we keep wait and see and wait until it progress to the cancer and do something else on that time.
And an audience asks, like, how can colon cancer be detected without a colonoscope culture, without a colonoscopy?
Okay. For the blood test, I think it's not the recommendation now. So there is no blood test that can confirm the diagnosis of the colorectal cancer. For the stool test, actually, it's just we detect the blood in stool. So blood in stool, there is many causes, not only colorectal cancer, maybe from other cause. So it's not specific enough to diagnose the colorectal cancer. Even the CT coronal. For CT coronal, we can see some thickness of the colon, but that thickness may be cancer or not. Sometimes it may be just piece of stool that attached to that area and it look like mass. So anyway, finally, I mean that if anyone who want to get the diagnosis of the colorectal cancer, colonoscopy with tissue biopsy is the gold standard. So we will not diagnose with only stool test or CT or blood test.
And an audience asks, how long can colon cancer go undetected?
Oh, okay, very good question. Actually, the colon cancer, there is many steps of the colon cancer to develop. It starts from, okay, I will select the picture to easier explanation. Actually, it takes time from the normal mucosa to be the colorectal cancer. This period is around 5 to 10 years. So the step will be start from the normal mucosa to be the small polyps. And some polyps will become bigger and bigger. And anytime part of the polyp will have a change and turn to be the cancer. And that cancer will grow up to the wall of the colon. And that is the invasive cancer. So all of these steps take around 5 to 10 years. So the screening with the colonoscopy or any technique, we want to detect the polyps because we can get rid of the polyps and prevent the cancer, as I told you. So it takes around 5 to 10 years. That is the period why we have to repeat the colonoscopy every 5 to 10 years because we want to detect the polyps.
So another question is, at what stage does colon cancer show symptoms?
Most of the case that the patient have the symptom is in stage 3. is stage 3. But not all case. I mean that even they have the symptoms, we cannot tell them that you already stage 3 because finally the diagnose that which state that that the patient have is depend on the final tissue pathological result. So, but it's just the statistic that the patient, if the patient have the symptoms, most of them will be stage 3. Not all case, just statistic.
So sometimes the colonoscopy finding show diverticulum. So is there any chance of like changing from diverticulum to colorectal cancer?
Okay, diverticulosis or diverticulum is not one of the risk of the colorectal cancer. So it may be just coincidence, but not have the risk, not increase the risk of the colorectal cancer. So if anyone who has the diverticulum, no need to worry that they have the risk of the colorectal cancer. Still keep screening with the colonoscopy, similar to the normal population, every 5 to 10 years.
So one question is, how can we prevent colon polyps?
Actually, it's similar to prevent the colorectal cancer. So some lifestyle that you can change, or the kind of food that you can eat, that you eat, okay, you can change it, lose your weight, do some exercise, and get the screening. Okay.
And okay. So like another question is like is there any like vaccine or any virus that are the risk of like having colorectal cancer? Because you mentioned about the pap smear cervical cancer in the female. So like is there any infection related to the colorectal cancer, and is there any way to prevent it?
Okay, so for the colorectal cancer, that is not related to any infection. Bacteria or virus is not related to the colorectal cancer. But it's different for other part of the colorectal. I mean, at the anus, the anal cancer, some type of the anal cancer, like squamous cell carcinoma, related to human papilloma virus. But it's quite rare cancer and not common, so no need to concern about it, except in the specific group, not in the common normal population.
Yeah. So I think the questions in the Facebook that's all. So before closing our Facebook Live session, is there any take-home message that you would like to deliver to our audiences?
So actually, the colorectal cancer is, we think or we conclude that actually is one of the preventable cancer. And the best prevention is you have to get the proper screening in if you have the age that around 45 or above than that, because if the patient get the colonoscopy and polyps was detected and that polyps was removed, it means that okay, there's no chance to develop cancer during 5 to 10 years after that, and repeat like this every 5 to 10 years. It means that that patient can prevent the colorectal cancer. But if you're afraid about the colorectal if you're afraid about the colonoscopy, we still have other technique to get the screening, like fecal occult blood test or even CT colonoscopy. And if everything was normal, okay, no need to get the colonoscopy. You can wait until it's positive. And if it's positive, at that time you have to get the colonoscopy to confirm that is there any problem inside your colon or not. So that is the best prevention. Other one is about your lifestyle and food. I think it's just the risk, and we did not know that how risk is it if you eat like the red meat or processed food. So sometimes you cannot change because it's your lifestyle. So, but if you can change, it will be best for you. Like quit smoke, reduce your alcohol use. But the screening test with any technique, I think is the best solution to prevent the colorectal cancer.
Yeah. So, uh, like people, all population should have their colonoscopy screening done like at the age of 45.
Mhm.
And if there is family history, they should do colonoscopy at the age of 40, right? Okay. Come. So, thank you very much, Kabaja. So for your time and also for your explanation about the risks of colorectal cancer. And also thank you all for your attention and all the questions. And we are sorry that we didn't have a chance to answer all of your questions. So please stay tuned for other Facebook Live session by our Bumrungrad International Hospital. Thank you very much. See you again.
Okay.